indicating 66 trillion for the first financial year. But because of Parliament's intervention, the budget increased to 72.1 trillion. So it's very, very important that the alignment must continuously be done to ensure that we can meet the targets that we've set out on that. The second issue is on statistics, and this is where our advocacy groups and also the ministries come in very, very highly. And I'll just share a simple example I had in my constituency. Sub-counties at 86%. When I did my own data collection, it was at 62%. And because of that, we could not get development partners coming to those two other sub-counties because they're indicating your coverage is more than sufficient. But after those statistics, as I speak now, the two development partners came in. We've had about almost 30 new boreholes, constructed in a span of about 2 or 3 years. Before we had just about 10 coming in per year. So it's very, very important that we also align our statistics and review and update them regularly and frequently. Every health facility has a primary health care fund. And part of that fund is supposed to go to maintenance and repair of water sources that are within the health facilities. But there's a challenge of governance. Again, I'll cite an example. But yet they had the PHC funds coming in, 27 million shillings per year coming in, but they just could not repair the water pump. When I threatened to repair it, which was just going to cost 150,000, the following day it was repaired. But for 6 months it was not being repaired. And they had solutions because I gave them an immediate solution. Get a water bowser. We have, every district has a water bowser under the district engineering department. With just 200,000 shillings, they were able to put 10,000 liters into their water tank, which had no water for 6 months, but were able to solve it. So there's a very big issue of governance. I think even at the schools, the capitation grants that come, I believe part of it should also go towards O&M. I have several times had to repair boreholes for some of the primary schools, but this grant is there, and I think there's need for more sensitization. But also there is the community grant or the community user fees that people contribute. Several times I've seen it has worked, but also there's an issue of governance because somebody collects the money for 6 months, and during that 6 months period, the borehole is not broken down. He gets an emergency at home, diverts that money and uses it for financing mechanism at a health facility level, at a school level, and also at a community level. Then there's the aspect, and also for even health facilities. And one of the strong components that has been looked into is the wash component, that for every health center being upgraded or being constructed, there must be the sanitation facilities, you must have the water points. So there's a need for us to strengthen that because we've seen in several cases in our oversight, the implementation is not fully done. And that is an issue actually of absorption. The money comes, but the advocacy groups. I've seen the statistics indicated that if you invest $1, you get back $7. I've always had a challenge with these statistics because every time I give the same statistics to the Minister of Finance, he says, okay, we'll put $1 here. Show me where I will reduce the $7. Because our budget every year keeps increasing. So we should be able to give already a clear, detailed narrative that if you put $1 on this, I expect the budget for education to reduce maybe by $7 for that $1. But unfortunately, we've failed to show us where it is. And I've also had the same discussions always with WHO. They sit further and see how can we be able to detail it further. And perhaps be able to say Uganda invested 1 trillion in the last 5 years and you were able to save this 2 trillion. And we should be able to put it out in the budget. Otherwise it becomes difficult for us when we're discussing the budget and we're using these statistics. It is real, but to functionalize it becomes challenging. So I thought I just needed to share that from my side.
And thank you very much, given that he's in research. So Dr. will kindly ask me exactly where does that 7 come from, and then also in regard to the achievement, again, his own ground data collection showed something different. O&M again comes